Hey, Future Peds pros. Welcome to your personalized deep dive. You've shared some fascinating material about the standards and ethics that guide pediatric nursing, and today we're going to unpack what that means for you as you step into this crucial role. Think of this as your shortcut to feeling confident about caring for kids and their families, with a big focus on being your champion, understanding how decisions get made, and, making sure their rights are always front and center. Let's dive in. So, standards and ethics in pediatric nursing. It might sound a bit, well, heavy, but this is really the bedrock of everything you're going to do. Why is it especially important when we're talking about our littlest patients?
That's a great question. When we think about standards and ethics, they really are our North Star. They give us the clear markers for what good care looks like and how we're accountable. In pediatrics, this becomes even more vital because kids are often in really vulnerable situations,
Yeah.
and their families are putting their complete trust in us. These guidelines help ensure we're all on the same page for providing the best and safest care.
Okay, let's unpack this a little. You mentioned some key North Stars. What are the main ones we absolutely need to know about?
Absolutely. The American Nurses Association, the ANA Code of Ethics for Nurses, is a big one. It's like the ethical foundation for our entire profession. And then, zooming in specifically on pediatric nursing, we have the Pediatric Nursing Scope and Standards of Practice.
Yeah.
These documents really spell out what's expected of us in terms of doing our job well and acting ethically.
Right, so those are like the big rule books, but it sounds like there's a whole support system around these, right? Not just those two.
Exactly. Think of it like this. We have the core ethical principles, and then we have layers of guidance built around them. Laws, hospital rules, and procedures, and even recommendations from expert groups like the Society of Pediatric Nurses and the American Academy of Pediatrics. They all contribute to the standards we follow every day. It's a comprehensive system designed to support best practice.
It's good to know it's all connected. And you know what really stuck with me? That Gallup poll thing? Nursing has been consistently ranked as the most honest and ethical profession for years. Wow, that's a huge responsibility.
It truly is. And it underscores the deep trust that people place in nurses. The ANA Code of Ethics isn't just something gathering dust on a shelf. It reflects those core values. And it's basically our promise to always act with integrity for our patients and their families.
So this code of ethics, it's not just one long thing. It has different parts, right? Provisions, I think they're called.
That's right. The ANA Code of Ethics is organized into 9 provisions. And as pediatric nurses, you'll see how they apply to your work all the time. For example, Provision 1 emphasizes treating everyone with compassion and respect, no matter what their situation is. Pretty fundamental. Provision 9 talks about our role in influencing policies to improve health, which links back to advocacy.
Okay, let's maybe focus on a few that really hit home for pediatric nursing, especially around being an advocate, navigating consent, and respecting patient rights. Provision 2 says our main focus is the patient, and that includes the child and their family. That makes total sense in PENS.
It's absolutely central, yeah. In pediatric nursing, we're almost always working with a family unit. The child's well-being is so intertwined with their family, so our ethical responsibilities extend to them as well. We need to be mindful of their needs, their values, and their active role in the child's care journey. You can't separate them.
And then Provision 3, this one feels like our superhero cape. It says we have to promote and advocate for the health, safety, and rights of our patients. That puts us right in the action.
Precisely. Advocacy isn't just a nice gesture in pediatric nursing. It's a fundamental part of our ethical duty. We are often the strongest voice for children who can't fully express themselves or understand what's happening. This provision calls us to actively work to protect their well-being, ensure they're safe, and stand up for their rights within the healthcare system.
Which brings us to Provision 4, respecting the patient's right to make their own decisions, or self-determination. Now, this gets interesting with kids. They can't just sign consent forms like adults, can they? How does that work?
You've highlighted a really important distinction there. While adults generally have the right to full autonomy, in pediatrics it's more nuanced. We navigate decision-making through consent, parental permission, and something really key for kids: assent.
Okay, let's break those down simply. Consent is usually for grown-ups, 18 and over, right? The legal piece.
Exactly. That's legal consent. For children, we typically need parental permission. Parents or legal guardians give permission for their child's medical care. But here's a crucial point. Parental permission isn't the whole story. It's not absolute.
Right, because even though a child can't legally consent, their voice still matters. That's where assent comes in, right?
You got it. Spot on. Assent is about getting the child's agreement to care, even if they don't have the legal authority to give consent. It means explaining things in a way they can understand, listening to their feelings, and involving them in decisions about their care as much as their age and understanding allow.
That makes perfect sense. Like, explaining a shot to a 5-year-old using simple words and maybe asking if they're ready or if they want it in their right arm or left. And if they seem really, really scared or say no, we need to take a step back, maybe.
Exactly. Even if a child can't legally refuse treatment, their reluctance or fear gives us important information. It tells us we might need to explain things differently, offer more comfort, or explore if there are alternative approaches if possible. It's about respect to the child as an individual, showing them they have some control.
Now, what happens when there are disagreements? This sounds tough. Maybe parents don't agree on a treatment plan, or a teenager has different wishes than their parents.
It can be incredibly complex.
Uh,
Yeah, these are some of the hardest situations. In these cases, we often rely on the best interest standard. Figure 2.2 in the material talks about this. This means we, as healthcare providers, need to make decisions based on what we believe is in the overall well-being of the child. We have to consider the family's values, definitely, but also the child's developmental stage, what they've expressed if they're old enough, and the medical facts, always prioritizing the child's health and safety.
And we also have to consider different beliefs, right? Like if a family's religious beliefs impact their healthcare decisions for their child, how do we handle that sensitively but safely?
That's a really important area, and it requires a lot of care. While we absolutely respect a family's right to raise their children according to their beliefs, there are ethical and legal limits, particularly when those beliefs could lead to significant harm or prevent necessary life-saving care for the child. The focus always has to be on protecting the child's well-being. There's that quote about not making martyrs of children. It really highlights that balance.
Wow. This all comes back to us being advocates, doesn't it? Being the voice for kids when they need us most, especially in these complex situations.
Absolutely. Advocacy is such a core responsibility.
Mm.
We are the champions for safe, high-quality care for our pediatric patients. And it's not just in the hospital room, right? It can be on a broader level, pushing for policies and resources that support children's health in our communities and beyond.
And a critical, sometimes difficult part of that advocacy is recognizing and reporting child maltreatment. As pediatric nurses, we're often the first to see potential warning signs, aren't we?
That's right. It's crucial. We need to be aware of factors that can increase the risk of child maltreatment. Box 2.5 lists some. And we need to know the potential indicators, both physical and behavioral, like those in Box 2.6. As mandated reporters, this means we are legally required to report any suspicion of abuse or neglect. It's our ethical and legal duty to protect these vulnerable children.
That can be a really tough call, though. What if you're not completely sure? The material mentioned that even if a family seems okay on the surface or, nice, we still need to be vigilant.
That's a vital point. Our personal impressions shouldn't outweigh our professional responsibility. The law protects those who report in good faith. If you have a reasonable concern about a child's safety, it's always better to report it. You don't need definitive proof. That's not our job. The priority is always the child's safety and well-being. Let the appropriate agencies investigate.
Okay. So beyond those really critical situations, advocacy also means supporting family-centered care, right? Making sure parents are involved and the hospital environment is as supportive as possible.
Exactly. Family-centered care recognizes that families are essential partners in a child's healing. They're not just visitors. Advocating for things like including parents in rounds, being flexible with schedules when we can, supporting resources like Ronald McDonald Family Rooms, Box 2.3 mentions factors that might cause stress for families. Understanding those helps too. These all contribute to a better experience and, honestly, better outcomes for our young patients and their families, helping us advocate more effectively and with empathy.
And all of this ties into respecting patient rights. Kids in the hospital have rights too, just like adults. There's usually a Bill of Rights posted, isn't there?
Absolutely. Most children's hospitals have a patient and family bill of rights, often based on models like the one in Box 2.4. It outlines things like the right to respectful care, to get information they can understand, to be involved in planning their care, to have their privacy respected, and to be in a safe environment. These rights should guide basically everything we do, every interaction.
It's so clear that being a pediatric nurse is about so much more than just the medical tasks, the procedures. It's about being a strong advocate, navigating these tricky ethical situations, understanding development.
Definitely. Developmentally appropriate care is key too. Kids aren't just small adults, right? How we talk to a toddler versus a teenager is completely different. How we assess their pain, Table 2.2 shows different scales for different ages. Even thinking about privacy or confidentiality or, having those difficult conversations about advanced directives with older kids when needed, it all has to be tailored.
And safety. Can't forget basic safety standards. Things like two patient identifiers seem simple, but are critical.
Absolutely paramount. Think about tiny ID bands, toddlers pulling them off,
Mm.
weight-based dosing needing double checks, medication safety, fall prevention. These standards are there for a reason, especially in peds where errors can have bigger consequences. We have to be meticulous.
And on top of all that, being culturally sensitive.
Yes, respecting diverse backgrounds, beliefs, diets, using interpreters, it's all part of providing ethical, holistic care.
And finally, truth-telling. Just being honest, right?
Right. Kids usually know when something's up. Communicating honestly in an age-appropriate way builds trust. Even when parents want to shield them, we have to consider what's truly in the child's best interest for coping.
It's a lot, but it's all connected by that commitment to the child and family.
Precisely. It requires critical thinking, empathy, and a real commitment to these core principles. Your dedication to these areas will make a huge difference in the lives of your young patients and their families.
Okay, future PEDS pros, we've covered a lot in this deep dive. Remember, being a pediatric nurse is about more than just medical skills. It's about being a strong advocate, understanding the complexities of consent and assent, and always upholding the rights of your young patients and their families. Keep those ethical principles at the forefront of your practice, stay curious, and never stop learning. That's a wrap. Keep doing the right thing and catch you in the next one.